Hey everyone, and welcome back to the channel. Life happens, and sometimes that means a little scrape, a quick cut, or even a bit of a puncture wound. But don't worry, knowing what to do can make all the difference in a smooth, speedy recovery. In today's video, we're diving deep into first aid for everyday cuts, scrapes, and wounds. We'll cover everything from cleaning tips to knowing when it's time to see a doctor. Let's get started. First things first, let's talk about simple wounds, the kind that don't usually require a trip to the emergency room. The key here is proper care to avoid infection and complications. So what exactly do you do? Usually minor cuts and scrapes will stop bleeding on their own. But if the bleeding persists, apply gentle but firm pressure directly to the wound using a clean cloth or bandage. If the bleeding is severe and doesn't stop after several minutes of pressure, that's a sign you need emergency medical attention. Once the bleeding is under control, the next step is keeping the wound clean. Rinse it thoroughly with clear water. Also, get rid of debris. If you see any dirt or small particles stuck in the wound, use clean tweezers to carefully remove them. And remember, keeping the wound clean also reduces the risk of tetanus, which we'll touch on later. You might think hydrogen peroxide and iodine are a great choice, but harsh chemicals like hydrogen peroxide or iodine should only be used on the skin around the wound, not directly on it. These can actually damage healthy tissue and slow down the healing process. When dealing with a cut or scrape, always consider how it happened. Puncture wounds, deep cuts, animal bites, or wounds that come into contact with dirt are at a higher risk of infection. For these types of wounds, it's best to consult with your healthcare provider. To help prevent infection and promote healing, apply a thin layer of an antibiotic cream to keep the surface moist. This helps your body's natural healing factors close the wound more efficiently. And then cover the wound. Bandages help keep the wound clean, protect it from further injury, and keep bacteria out. Change the dressing daily or whenever it becomes wet or dirty. Now, let's talk about when a trip to the doctor or emergency room is necessary. Bleeding persists if the blood continues to flow after several minutes of pressure. Deep or wide wounds. If the wound is very deep, wide, or involve exposed fat or muscle, you likely need stitches. Deep or edge wounds with exposed fat or muscles may require stitches to hold it together for proper healing. Strips of surgical tape may be used to close a minor cut, but proper closure will help minimize scarring. This is super important. Keep a close eye on your wound for signs of infection. If the wound isn't healing steadily, or if you notice any of these symptoms, see your healthcare provider immediately. Redness around the wound, drainage or pus, warmth around the wound, swelling. A cut, especially a puncture wound, can lead to a tetanus infection. Tetanus is caused by bacteria found in soil, so even seemingly clean cuts can be at risk. Active immunization is vital for everyone in the advance of an injury. If you haven't had a tetanus booster in the past 10 years, talk to your doctor about getting one, especially if you have a puncture wound or a dirty wound. One last tip, puncture wounds can be tricky. They don't always result in excessive bleeding. Sometimes little blood flows, and the wound seems to close almost instantly. This can trap bacteria deep inside, increasing the risk of infection. So be especially vigilant with these types of wounds. So that's it for today's video on cuts, scrapes, and wounds. Remember, a little knowledge and proper care can go a long way. If you found this video helpful, give it a thumbs up, subscribe to the channel for more health and safety tips, and share it with your friends and family. Stay safe, and I'll see you in the next video.